Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service. 73140, radiologic examination, fingers, minimum of 2 views. This code is used when 2 or more radiographic views are taken of 1 or more fingers, 1st through 5th digit. The views are focused on the interphalangeal joints and phalanges. These projections are essential for evaluating traumatic injury, joint abnormalities, or deformities. Thumb views, a P or PA view, standard for assessing alignment in bone injury. Oblique view, highlights the thumb base and fracture lines. Lateral view, shows displacement or joint disruption. Fingers, 2nd through 5th digit. PA view, evaluates alignment of all 3 phalanges and joint spaces. Oblique view, offers a diagonal view for better visualization of cortical bone. Lateral view, best for detecting subtle fractures or dislocations. In some trauma situations, a PA hand is used as an alternative to a focused PA finger or oblique thumb view. Report example. Order exam, fingers 2 views, right, header, PA, lateral and oblique views of the small right finger. 5th, history, fracture, comparison, none available. Findings, no acute fracture. There is a chronic appearing deformity at the radial portion of the small finger, proximal phalanx head. Mild ulnar deviation at the 5th proximal interphalangeal joint. Impression, deformity of the small finger proximal phalanx and pip joint may reflect old trauma. Let's look at the views. PA, lateral, and oblique. That's a total of 3 views. This qualifies for CPT code 73140, radiologic examination, fingers, minimum of 2 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, a chronic appearing bony deformity of the proximal phalanx of the right small finger, likely post-traumatic. No acute findings. The radiologist specifically describes a bony deformity, which is chronic and localized to the right hand, 5th digit. There's no evidence of an acute injury, and the report does not describe active treatment or healing. Therefore, a musculoskeletal condition code is most appropriate, specifically one that describes a bone shape abnormality. The most appropriate ICD-10-CM code is M85.841, other specified disorders of bone density and structure, right hand, chosen to reflect the chronic bony deformity described in the proximal phalanx of the right small finger. This is not an acute fracture and is unrelated to a systemic bone disease. The correct codes for this chart are 7314, right, radiologic examination, fingers, minimum of 2 views, and M85.841, other specified disorders of bone density and structure, right hand. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.